Nicola Sturgeon, welcome to you. You've been
Thank you.
You've been pretty measured about the London government's handling of the crisis so far, but one of your MPs, Stuart Hosey, has been much less measured. And the SNP put out his comments in a press release this week. He said that the government's response had been botched, shambolic, too slow, too late, too chaotic, must get its act together. Is that basically your view as well?
Look, I understand, because I'm First Minister leading a government, how difficult and how unprecedented this situation is. We're all trying to make the best decisions we can, undoubtedly getting things wrong along the way, as every government across the world will be. And I've been very clear about that from the outset. I'll make mistakes. Everybody involved in leading these responses will make mistakes. But it's really important we take the best decisions we can at every single stage and try to learn from that as we go. I mean, certainly right now, the measures that are in place are having an effect in suppressing this virus. We see that in the data we publish every day, hospital admissions and intensive care admissions. But it's too early right now to have any confidence that we could lift any of these measures without seeing the virus potentially run out of control again. And I think, firstly, it's important to be honest about that. It's also important to be frank that, you know, at the end of this 3-week period, there's no guarantee that any of these measures can be lifted. But as we do start to ease them, it's not a flick of the switch moment. There will be a real need for care and caution in a very slow and gradual process. And I think the more we can have that conversation in a very open and frank way, recognising the uncertainties and the difficulties of the path ahead, then the more likely we are to take the public with us as we take these difficult decisions.
Well, let's try and have that open and frank conversation, Nicola Sturgeon. I'm not going to hold you to anything, nor do I expect you to make policy on the hoof. But, for instance, you've talked about reopening schools. Now, if social distancing is going to be applied to schools, then clearly far fewer pupils can be in each classroom than normal. Do you think we're going to see kids going to schools, maybe some of them only on Monday, Wednesday and Friday, others on Tuesday and Thursday and Saturday, or perhaps only some in the morning and others in the afternoon? How do you think it's going to work, or could work?
So in general terms, yes, I think arrangements like that may well be what we have to put in place to allow children to start going back to school. Now, again, just let me be very clear, it would not be right or safe to open schools right now, and that may continue to be the case for some time to come. But the point I think everybody is trying to get their head round right now is that as we come out of these very restrictive measures, we're not going to be going back to normality as we knew it. It's what I described, and many others have used this phrase, a new normal that we're looking for, where social distancing will be a fact of life for quite some time to come, and different ways of operating will have to be contemplated. So I've said over the course of the last few days that arrangements just like the ones you've set out there, in whatever form we decide is best there, may well be how we get schools to slowly and in a very phased way come back into operation. And what we need to do as we look at measures like that, but also other areas where how we get businesses to open up again, we've got to be very clear that we measure and model and try to predict the impact of all of these things. Right now, what we're trying to do, and having some success, although we can't be confident that we've succeeded enough, is driving the number of cases down to as low a level as possible, and crucially keeping that reproduction rate as far under 1 as we can. Now, we think we're making progress with that, but we need more data to be confident. And then some of the margins we will be faced with as we start to ease things are very, very fine indeed. So there will be a need for real care and caution, and perhaps on some instances to go back again if we find that things that we have done have allowed the virus to run out of control.
Well, let me ask you about something that I think people up and down the country are thinking about, which is grandparents and parents. If they'll forgive me, my parents are not in their absolutely first flush, living outside Dundee. When do you think it's likely that I will be able to go and see my parents?
Look, I'm not going to give you a date for that now, Andrew, because it would be irresponsible for me to do so, because I don't yet have the information that gives me the confidence that I can say that with certainty. What I would say is that, one of the most difficult, if not the most difficult aspect of all of this is that need for grandparents to be separated from their grandkids. My own parents are suffering from that right now. Grandparents up and down the country are in the same position. Now, it's really tough, and nobody wants that to be the case for longer than necessary. And this is also a tough thing to say. This is about the protection of older people who we know are much more vulnerable to becoming ill and dying from this virus than other age groups. And I guess it's to try to make sure that grandparents are around for longer to see their grandkids grow up. But it illustrates very, very well just how incredibly difficult all of this is, which means these decisions, don't get easier as we move on. No. They actually get tougher, because we may go from a position that we're in right now and need to continue to be in for a period to come of saying to everybody, stay at home, isolate in certain circumstances, to messages that might be a bit more nuanced, which makes the communication of them even more difficult. And that's why, again, I think it's so important that politicians try to share as much of this thinking and as much of the uncertainty as we can.
One area of uncertainty is who you'll be able to socially mix with in the going. You've used the word a bubble of people. How many people do you think will be in that bubble? How many other people will we be able to have a conversation in person with?
Well, again, I don't know the answer to that right now. This is very strange territory for politicians to say, I don't know. But these are the kind of things that we're looking at. So, for example, we're all in a sense right now being told to stay within our own household bubble. So the advice is clear right now, and this remains the advice: don't mix outside your own household. One of the things, and some other countries have been doing this as well, is could that definition of a household be slightly extended so that you could mix with maybe one or two other people outside it, as long as they were the only ones you were mixing with and you were the only people they were mixing with. So I'm using these examples to illustrate the kind of work that we're all starting to do. And as soon as we published a quite high-level document on Thursday, over the days and weeks to come, we want to translate that and evolve that into something with harder answers to these questions attached to it. So we've got more detail with timescales and milestones attached.
It does look as if Scotland might exit the lockdown in a slightly different way, with different regulations or rules, than England. In those circumstances, I know that you like questions about borders. Do you have the power to close the border if you need to?
I don't have the power to close borders, but these are discussions, of course, we want to continue to have with the UK government. And on this question of will Scotland do things differently, not for the sake of it, we won't, only if the evidence and our judgment tells us that that is necessary. Now, that would mean if, and it is an if, I'm not saying that we're likely to get into this territory, if the UK government took decisions that I thought were premature in terms of coming out of the lockdown, then clearly I would want to make sure that Scotland did what I judged was best to protect the population. But the virus doesn't respect borders or boundaries, and people travel freely across different parts of the UK, and that's why I think it has been important, as well as for the simplicity of messages, to have as much consistency across the UK as possible. And I think that's still the starting point, but we all have to take decisions that we judge to be right. It's not political in any way, shape or form.
All right, let me talk to you about testing, because originally you said you were going to have 10,000 tests a day by the end of April. Then you downgraded that to 3,500 tests, and you're still below 2,000 tests. Testing is not going well in Scotland, is it?
Well, I don't think you're factually correct in the first part of that. 3,500 capacity for tests by the end of April was what we said. Then when the UK government set its 100,000, we said we would seek to make sure that anything they were doing proportionately applied to Scotland as well. We are absolutely on track, not just to meet that capacity, but probably exceed it by the end of April. The challenge now, and progress has been made on this every day, is to make sure that that capacity is being fully utilised. So we had 3 objectives for testing at the outset. We're expanding some of those categories and looking to see how we go beyond that even further. So, for example, working care homes, expanding to different groups of key workers. So that is ongoing. Plus, we're increasingly, as all governments are, looking to how we go to a much more expanded system for a test, trace, isolate approach in the next phase.
Right, you mentioned care homes there. 1/3 of Scottish deaths have been in care homes in Scotland. That's a lot more than in England and Wales. Why?
Well, look, I don't know what the England and Wales figures are entirely based on. Okay, but I'm not. I think it's for others to suggest. I've read comments that suggest that perhaps there is an underestimate in the rest of the UK, but I can't say that for sure. What I do know is that if you look at the emerging evidence from other countries, and there's been some work published on this in recent days, then in many other countries the percentage of deaths in care homes are much more in line with what the figures in Scotland are showing. In fact, even higher. Some countries it would be 40 to 50%. Now, Scotland's data that we are publishing, we're publishing data that is more up to date than other parts of the UK, and I think more granular in many respects. But we're also, more importantly, taking a whole host of actions to try to prevent and control infections in care homes.
Let me read you one other explanation which came from the GMB Scotland Union, reported in the Scotsman newspaper on Thursday. They said social care workers had to wait until 5 weeks after the first COVID-19 infection in Scotland to receive clear and unambiguous guidelines on PPE, and many still do not have the proper PPE to do their job safely. More than 2 months after the first infection, there is still no robust testing programme for workers to help mitigate virus spread, sustain services and save lives. I say to you again, something is going wrong.
Look, I would challenge some of that, although we talk to the GMB and others on an ongoing basis, because I believe the responsibility on me and government is to respond to any concerns and try to address them along the way, which is what we have been doing. There's been clear guidance in place for the management of infection in care homes for some time now. And remember, care home providers are in the prime position here to make sure that they're protecting their staff and their residents with the support of government. We've been working to make sure not only that we have the supplies of PPE, but they're getting to where they're needed. We've put new supply distribution routes in place. We now have been delivering PPE direct to care homes as well as through local hubs. So this is work that is evolving on an ongoing basis, because the responsibility to make sure health and care workers are protected is one of the most important that any government bears right now.
All right, Nicola Sturgeon, thanks very much for getting up to talk to us today.
Thank you.
Thank you very much indeed.